Welcome to Coffee and Conversation AI in Healthcare. I'm Jen Hand from Informatica, and we are here today with Dr. Bipin Mistry. He's a board-certified internal medicine physician and CMO at Alight Solutions. So Dr. Mistry co-founded Hospital Medicine Solutions in 2013, still serves as the CEO, overseeing program evaluation, operational efficiencies, and physician coaching. So Bipin, we're excited to have you here. And I know you've spent a lot of your career working to improve healthcare, issues related to advancement in health equity, and we are really looking forward to picking your brain today. So thanks for coming on.
Yeah, thank you, Jen. Thanks for having me. Look forward to the conversation.
And before we dive into your work at Alight Solutions, I wanted to chat a little bit about your role at Take Pause. And this is a virtual reality program for reducing teen anxiety. It's an incredible organization and work I think more people should know about. So would you mind telling us just a little bit more about this organization, your work in that, and what role you see AI and VR playing in tackling this issue of mental health?
Sure, happy to, Jen. So yeah, I first came across Take Pause a few years ago, and the founder of Take Pause has a very interesting background. And it's usually when you start to look at sort of startups, it's the founding story, which is really sort of quite gripping. And so, she's a BBC war correspondent and has seen a lot of stress at the front lines. And as a result of this, she's really sort of taken upon herself to try and help address anxiety, in particular in the sort of teenage population, which is often something that was never really, it was present, but never really sort of in the spotlight. But I think since COVID, it's become increasingly in the spotlight. I think the power of VR is an evolving science. I think that it certainly had an impact when you look at especially teenagers, adolescents. That generation has adopted it in terms of what they've seen, what they've been able to do with it. And so I think applying it to healthcare, it has had some interesting results. With regards to Take Pause, we focused mainly on teenage anxiety, and started off with sort of addressing or testing it in the emergency room, urgent care settings. And it's had a really positive impact in terms of reducing the stress, because we always measure before and after the experience to see where people's stress level is. And because they're in the emergency area, that we can also see that their vital signs have improved. For example, the heart rate has come down, the breathing rate has come down. And we're still sort of in the process of trying to prove the ultimate clinical effect, meaning that, people are in these high stress situations, maybe they've broken a bone, or there's pain, and sometimes and as a result of that they need medicines. And we are seeing anecdotally that there is a reduction in pain needs, but we're still sort of in the process of proving that out. And so I find that really fascinating that we can start to use these newer technologies to apply in healthcare. And I think there are other companies that are using VR for other needs, for example, in the perioperative space, helping to reduce anxiety and therefore needing less medications. And so therefore that leads to quicker recovery post-procedure. So I think it's fascinating. And really it's the final point I would want to make is that, this in conjunction with other modalities to reduce stress and anxiety, especially in teenagers, is potentially a very powerful adjuvant solution.
And I think one of the benefits that came out of the post-pandemic world is this reemergence, or maybe even emergence, of a focus on mental health, especially in teens. And so I think it's incredible to watch the creativity of tech solutions that are now being applied to helping with this crisis. So it's amazing that you're involved in this organization, and I wanted to lead off with that because I think it's such an important piece of healthcare, this mental health part. So thank you for your work in that. And I know your main role as CMO at Alight takes a lot of your time and effort, but employee well-being over the last few years has been in the spotlight as more employers are working to create health plans that drive value for their staff. So What's been your experience working towards the adoption of a value-based care system in the employer-sponsored insurance space, and where do you think AI fits into that?
Yeah, it's a great question. I think, first of all, I think value-based care is the way of the future when it comes to dealing with healthcare expenditure and health outcomes. Having started a lot of my research about 10 years ago in this model, I think what I've seen from a macroeconomic perspective is that, CMS, Centers of Medicare and Medicaid Services, has really been the one that's really been at the forefront of this design change. And I'm grateful for that, because having been involved in the bundled payment programs and the ACO, Accountable Care Organization programs, we've seen some good results from that. And part of it is that, healthcare is fragmented. And the fact that you have a value-based care system allows for it to become less fragmented, and people are having to talk to each other. There's better sort of teamwork around the patient and the member. So that's great from the supply side of the health system that I've experienced considerably, being a inpatient doctor, as well as sort of colleagues and talking to hospitals and health systems and provider groups. But it's a difficult journey, for sure. I think I think that the health system and the providers are pretty much nearly there with understanding that the future is not being paid for volume or fee for service, but more for value. And so they've had to adapt and reorganize themselves around that. And you see a lot of headlines about, various health systems going full force into the value-based care system. So that's great. So the supply side of healthcare is now sort of embracing it and trying to make adaptations in in how they work in the system. Now, the issue is that, from an employer stance, because they're often self-insured, they depend on the health plans to try and sort of organize themselves to promote the idea of value-based care. And I think that's where we're having some slow starts. The carriers have tried to sort of work in this manner, and they've done things around, creating networks of distinction. So recognizing who those doctors' systems are that provide great care and good quality, and then they've tried to do things around bundle payments. So doing some interesting things around contracting. At the end of the day, they still have to serve up a network, so they still have these contracts. So for them, the hurdle is a little bit harder. Obviously, Medicare Advantage, if I take that bit out, because that doesn't necessarily affect the employers unless they're involved in some retiree exchange. But at the end of the day, most of the value-based care work has been around Medicare Advantage when you start to look at the health plans, when you look sort of below the surface. But when it comes to the employer world, I think it's still very early in its stage around, what does value-based care look like? And so that's where sort of, as I think about the work we do at Alight, the clients that we serve, and bearing in mind, Alight services a whole extent of activities for an employer, from hiring the individual right through to retirement. So we affect all stages, and it depends what the clients want to purchase from us. So that includes enrollment, payroll, 401k, HR management systems, and then leaves management, and healthcare navigation, and then retiree exchange. So you can start to see that, at Alight, we have this incredible opportunity to understand what our clients and employers are thinking. And so, on that note, I think that the employers are definitely interested and want to sort of move more into that sort of value-based care activity. And so what we're seeing is that, doing small things like, contracting with companies that do special type of surgeries with contracted rates at so centers of excellence. We're seeing some employers actually doing direct contracting with certain health systems. You hear about, folks contracting with Cleveland Clinics or the Mayo or the Memorial Sloan Kettering. So you get these sort of direct contract situations where he's trying to sort of carve out the key elements of your of your population health spend to COEs. But I think what is going to be pressing for employers going forward, it's always been top of mind, but I think what we're seeing is that the trend in medical spend is actually going to be worse next year, because COVID kind of dampened it in terms of not so many surgeries and elective procedures, but you're going to see, we're seeing this uptick this year, and I'm sure and there are predictions that the medical trends for employers is not going to be 6%, it's maybe in double digits for 2024 and 2025. So you can see there's a big sort of burning platform to sort of understand how can we do better with the medical spend that we have. And I think that's where there's going to be more push around how do we create this value system within through our health plan, or without our health plan. You are getting some employers who are replacing the typical top 4 health plans with something else, and so that's probably in an attempt to sort of better manage the spend, drive value, improve outcomes. I think to your question about what is the role of AI in all of this, I think it's a really fascinating time with regards to AI. Aside from the fact that Mr. Altman was let go from OpenAI recently, there must be an incredible story underneath that. But the point I'm making is that I think AI is definitely making people think of how does this fit into healthcare. And there's a couple of things that we'll probably get into a little bit later, but I think there's a tremendous opportunity to try and sort of use AI to try and personalize care journeys, sort of anticipating the needs of a member or a patient as they go in and out of the health system. Maybe create some efficiencies so that they're not having to search and do this hunting and gathering for information, because a lot of people just don't know where to look or what to do. And so maybe we can sort of use AI to surface up trusted information that makes sense for their healthcare journey. I think there's also an opportunity to make recommendations and sort of nudges for patients that may be in difficult healthcare journeys or have a chronic disease, and trying to make sure that they're staying on top of their condition, because it can be hard with a chronic disease to maintain everything. And then I think also the role of AI around equity of care, and so that I think there's lots of opportunities there. It's going to be a journey. Everyone's worried about AI replacing jobs, so I can just imagine that there's a level of distrust, and so when it comes to healthcare, people only consume it when they need it, and it's often stressful. So you can just imagine there's going to be some inherent perceptions or barriers that we're going to face, and so it may take several years before people really truly adopt AI in healthcare, and especially on the employer side.
Yeah, and I think that's a great point about the fear, because healthcare is a high stakes domain. Health is so important to the person who is exploring health solutions or chronic conditions or looking for surgeons, and naturally there is trepidation and fear of this thing called AI for maybe the layperson. And interesting what you're talking about, the rising costs of medical expenses in the next year or couple of years. I'll be curious to see how AI enters more and more into those conversations, because it's almost like you can't ignore if things just keep going up and up and up. There has to be a conversation around, okay, how do we lower costs? How do we keep people in network? How do we look at reducing claims and things like that? So yeah, you're in an interesting spot with your role in the spectrum of employer services, but also at the forefront of this relatively new space with the employers in the insurance
Right.
plan. So yeah, it'll be interesting to see the next few years as it plays out.
Yeah, and we use AI to help personalize the journeys with our clients. And the beauty of AI is that, often in healthcare, most organizations will rely on medical claims data and pharmacy claims data to try and drive some of the AI. But what we've seen with some of our clients is that there's some non-medical claims data that can actually give us some insights as to what could be happening for an individual. So I can give you an example. Especially during COVID, we saw that people were actually borrowing against their 401k, or reducing their funding towards a 401k, when historically they've been always maxing it out and things like that. So you can start to see that those could be potential signals that there may be some underlying stress. Aside from COVID being stressful, there may be other things going on. So you can start to see other data points that can help you potentially anticipate or be able to reach out to an individual to see if they need any help. Obviously, I think going back to the trust and not trying to be too spooky and around the data, there's a balance. How does the messaging get across to the individual? And I think that's also going to be an interesting journey for a lot of people. So yeah, I think, and then you've also got, macro environmental, international things that can affect someone's mood and stability, especially a lot of these organizations where they're multinational, and so you've got some other things to think about when you think about AI and personalization and trying to sort of reach out to individuals. So yeah, so it's pretty fascinating, and I think it's encouraging, but I also think it's going to be a journey that we're going to learn. There's going to be mistakes, absolutely, but as long as we sort of we're heading in the right direction of trying to do better for people.
Yeah, and I like the point about a journey, because just within the last 10 years, we've seen more automation, more AI in Siri and Alexa, and just day-to-day transactional life things. So it makes sense that it's also going to be that way in healthcare, that we learn, we grow, we get feedback, and kind of continue to tweak that. So one area I want to explore, I know you mentioned health equity, and you've written a lot about addressing racial and ethnic healthcare disparities in your career. So achieving health equity is always a hot topic, and it's debated in the realm of AI of how do we actually achieve this goal. So I'd love to hear how you see AI helping to address inequities as it relates to healthcare.
Yeah, it's a great question. I think there's a couple of things. One is that it allows us to bring information together, meaning that we can start to address the questions in the way that people want to receive the information. Because often, when you go to a health plan site or any medical site, it's very, obviously healthcare literacy is kept at a certain level. But can you imagine having that variability in healthcare literacy depending on how people want to consume the information? So I think that's the beauty of in terms of AI and how you drive healthcare literacy. The second piece is, I think you can use AI to help anticipate future needs of an individual. And if you tie that into social determinant scoring and understanding where people are in terms of their community, their environment, what is and isn't available, and you can tie it to from an employer standpoint, what other benefits they have. You can start to sort of bring this world together in a way that kind of makes sense for the individual.
Yeah, I like the personalization and aggregation of data in helping to centralize things, or have all of the, a person can access everything at once to help shape equity, equality, and really, how does that shift into improving social determinants of health? I mean, that's an even maybe more intriguing question, and one that we'll see as AI unfolds in healthcare. But how would it affect access to groceries, access to parks, access to social engagements and activities and things like that. And in our dream world, AI would help to really look at all of these things. But I think starting with the data and starting with the access to care is a huge component, and one I know you're passionate about and have written a lot about. So yes.
Yeah, that's a good point, Jen. And just one other comment is that I think it helps the providers, the health systems and the doctors also be able to sort of manipulate or modify their message to the individual based on what they see from the electronic medical record, but what else is going on in terms of social determinants of risk scoring. So I think it's really fascinating because I think it also helps physicians and health systems do better at the point of care. So that's going to be really fascinating how that, so you're seeing AI being used in the electronic health records to try and sort of do simple things like reduce the burden of paperwork for a lot of people. There's lots of forms that we have to fill out just to make sure that they can get what they need from a durable medical equipment perspective. So these are things that we can start to see as we sort of go in the value chain, doing simple tasks to then sort of more complex tasks. It's going to be an interesting journey for sure.
Yeah, and I think the theme is the journey, and we're smack dab in the middle of the unfolding of the journey. So we'll have to come back, have you on next year, and see how much we've progressed and what changes we've made. So thank you so much for your time and your conversation and your insights. We appreciate having you on, and looking forward to seeing how the journey unfolds.
Thank you for having me.